I think everyone should pay attention to what Dr. Deborah Birx said. She's part of Trump's coronavirus task force.
Okay.
And she recently made an announcement that regardless of any underlying health issue that could have contributed to the loss of someone's life, they're going to count someone that dies with COVID-19 as dying of COVID-19. So this is a very interesting point because we know that a lot of from the research, the cases of people that are dying from this or catching it as well have underlying health conditions. These are people typically older.
And this is what we've been reporting on, right? This is exactly, we talked about the death certificate. We said it looks like they are trying to bolster the numbers. And in fact, I think we have the video of her saying exactly that. Let's take a look at this.
So I think in this country, we've taken a very liberal approach to mortality. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
It's amazing when you report something and say that this is what is clear. When we showed you the death certificate last week, that they are promoting the idea, forget that they had cancer and were in ICU anyway, or forget that they had an underlying, heart disease and condition that was probably going to claim their life this year. We just want to see this as a COVID-19 death. I've been talking about this in my house, and my 11-year-old son actually asked me the question. He's like, so Dad, if someone's in a car accident and they end up like chopping off their arms and legs and they're now in the ER and they end up bleeding to death, but while they're in there, they're tested positive for COVID-19, are they going to call that a COVID-19 death? And I honestly think, I looked at my 11-year-old son and said, you know what? It's a really good question. Based on what we're seeing here, they do not care if it's COVID-19. If you're dying with it, then you're dying from it, it flies in the face of what we're told coming out of Italy, right? That in Italy, they said when they went back, they clearly saw that 88% of the cases, you had to say those underlying conditions are what killed them, not the COVID-19. So they're really bolstering these numbers. They are really, and they're saying it right to our faces. We are going to blow these numbers up. In fact, you have a couple other reports that show reasons they might also, in ways they might be bloating this. What's that about?
Yeah, well, another possible angle is the CARES Act. This was the stimulus package, the third phase of the stimulus package passed last week and signed by Trump. The CARES Act reimburses hospitals' Medicare rates for the care of uninsured COVID-19 patients. It also adds 20% increase in Medicare reimbursements for COVID-19 hospitalizations. So these are two data points that are very interesting when you start looking at these data numbers.
So they're actually saying, if you call it a COVID-19 death, we're sending more money your way. You don't have to worry about if that person in the ER is uninsured. Don't worry about it. They'll be covered as long as it was COVID-19, and we're seeing a big problem with this. We're seeing doctors, and I'm not going to get deep into this because we know it's happening now. This is now becoming a mainstream discussion that the Highwire shared just last week. We see doctors speaking out against this, saying, this is insane. I've never had to do this before. Yes, I've had patients in the past that were dying of heart disease or lung disease or cancer that had the flu, but they didn't tell me I had to call it a flu death because that made no sense. And now they're tying my arms behind my back. You can go online and see these videos everywhere. All right, let's talk about the numbers. Where are we at? What else is happening?